Today we will talk about upper limb. So first we will talk about the bones which are forming the upper limb. The first bone, clavicle, scapula, humerus, radius and ulna, carpals, metacarpals and phalanges. So first we will talk about the clavicle and the total number of bones in upper limb. (32) in each limb. So each upper limb has 32 bones. So first bone is clavicle. This is also known as the beauty bone or collarbone. See the picture of clavicle bone. This is clavicle. This clavicle bone, it has two ends. This end is medial end. This is the medial end. See this is medial end. And this end, this is lateral end. So medial end, it is round. It articulates with the sternum. So it is known as the sternal end. And the lateral end, this lateral end is flat, articulated with the acromion process of scapula. So it is known as the acromial end. It has two borders. On the medial side of the bone, it is more or less round. So it has four surfaces. This is superior surface. This surface anterior surface. This is posterior surface and the inferior surface. While in the lateral part, this bone is flat. So when this bone is flat, it has two borders. This is anterior border. This is posterior border. This is superior surface and the inferior surface. So in the lateral part or the lateral 1/3 of the bone, clavicle has two surface, two borders. Superior surface, inferior surface, and the anterior border. This is the anterior border and this is the posterior border. While the medial 2/3, this is the medial 2/3 up to this clavicle bone, it has four surface: superior surface, inferior surface, anterior surface, and the posterior surface. So borders are absent at the medial 2/3 of clavicle. Now see this is the medial end of clavicle bone which articulates with the sternum to form sternoclavicular joint. See in this picture, this is the medial end articulate with the sternum to form this is the sternoclavicular joint. This is the acromion process of scapula. This is the lateral end articulate to form the acromioclavicular joint. Now all the bones, they provide attachment to the muscles. These are the skeletal muscles, and these skeletal muscles, they are shown with two colors, red color and this is the blue color. So red color shows origin, blue color it shows the insertion of muscle. Some part of the muscle originating, which is area marked with the red color, and some muscle is inserted in the area which is marked with blue color. See here, this is the green color. Green color in every bone, it shows the attachment of some ligament. Here, this is a very important ligament, coracoclavicular ligament, which is attached on inferior surface. So now I will write the features of the clavicle bone. So this bone, it is present in the region of the collar area. Collar area, it is the junction of the neck and the thorax. That is why it is the collar bone. This bone is palpable throughout its extent. That is why clavicle bone is also known as the beauty bone. Now see this. This is the clavicle bone. This is medial end. This is lateral end. So as I shown you, this medial end, it is the sternal end because it articulates with the sternum. The lateral end is acromial end. It articulates with the acromion process of scapula. This sternal end, it articulates with the sternum to form a sternoclavicular joint. What type of joint is this sternoclavicular joint? It is synovial joint, saddle variety. It is the synovial joint of saddle variety. It is a complex joint. Complex joint are those joints which have intra-articular disc. If intra-articular disc present, that joint is a complex joint. It means joint space is divided into two compartments by intra-articular disc. See here, this is the joint space which is divided into two parts by intra-articular disc. This is the intra-articular disc. So see, in this joint space is divided by intra-articular disc into two parts. The question can be asked, what are the other examples of complex joint? The other examples of complex joint: knee joint, temporomandibular joint. This is the TM joint. Now the acromial end, it articulates with the acromion process of scapula to form acromioclavicular joint. What type of joint is this? Acromioclavicular joint. It is the synovial joint, plain variety, or it is a plain synovial joint. Now the next point is the muscle attachment. What important muscle attachments present in the clavicle bone? As I told you, the muscle attachments mean the attachment of skeletal muscles. We divide these muscle attachments into two categories. Number one, origin. Second one is the insertion. So origin, it is shown with red color. Insertion, it is shown with blue color. Origin remains stationary. During contraction. While insertion, it moves during contraction. So this is the technical difference between the two ends of a skeletal muscle. One is origin, another is insertion. Both are subdivision of attachments. Now what are the muscle attachments on clavicle? For that purpose, we divide the clavicle bone into three parts. This is the medial 1/3, middle 1/3 and lateral 1/3. So muscle attachments first on medial 1/3 of clavicle. Medial 1/3 of clavicle. So first muscle is sternocleidomastoid. Sternocleidomastoid muscle. This muscle takes origin from superior surface. From the superior surface, medial 1/3 of clavicle, there is origin of sternocleidomastoid muscle. This is the muscle of neck region. It is present here in the neck. So sterno means sternum, cleido means clavicle, and mastoid means mastoid process. So this muscle takes origin from sternum and clavicle bone, and it is inserted at the mastoid process of temporal bone, present behind the pinna, easily palpable mastoid process. So this is the sternocleidomastoid muscle. The second muscle, this muscle is pectoralis major. Pectoralis major muscle. This is the muscle of chest region. This muscle originates from anterior surface. From the anterior surface of the clavicle. This muscle also reaches towards the middle 1/3, or we can say the anterior half. Anterior half surface gives origin to the pectoralis major. Anterior surface of the medial 1/3 plus anterior surface of the middle 1/3 half gives origin to pectoralis major. Now we will talk about the lateral 1/3 of clavicle. Lateral 1/3 of clavicle. Here this number 3 muscle, this is the deltoid muscle. Deltoid muscle, it originates from anterior border. Deltoid muscle originate from the anterior border of lateral 1/3 of clavicle. This deltoid muscle, it is the muscle of shoulder region. It is the deltoid muscle. Now the next is the number 4. This muscle is inserted at the posterior border of lateral 1/3 of clavicle. So this muscle is a trapezius muscle. Trapezius muscle. Trapezius muscle is inserted on posterior border of lateral 1/3 of clavicle. And the trapezius muscle, it is the muscle of back region. The fifth muscle is subclavius. This muscle, it is concerned with the middle 1/3 or intermediate 1/3 of clavicle. Middle 1/3 or intermediate 1/3 of the clavicle. Here is the insertion of subclavius muscle. Insertion of subclavius muscle. On inferior surface. On the inferior surface of the middle 1/3 of the clavicle, insertion of subclavius muscle. See in this picture, if this is the superior surface, then on the inferior surface. That is why I am showing you with this dotted line. This is the insertion of subclavius muscle. This muscle belongs to chest region, pectoral region. So this is the muscle of chest region. So these are the important muscles attached on clavicle bone. Now in the next part, what are the important features of clavicle bone? The features of clavicle. It is the only long bone. Clavicle bone is a long bone, but it is the only long bone which is horizontally placed. All other long bones like humerus, radius, ulna in the lower limb, femur, tibia, fibula, these are all vertically placed. Clavicle is the only long bone which is horizontally placed. So it is a unique feature of clavicle bone. The second is, it is the first bone to ossify in body. At what time this bone formation begins? It ossify at the age of 5th week of intrauterine life. All other bones start forming at 8th week of intrauterine life. So it is the first bone to ossify. The next, ossification center. Ossification center is the center where bone formation begins. These ossification centers, they are divided into two parts: the primary ossification center and secondary ossification center. The primary ossification center, it appears before birth. Secondary ossification center, it appears after birth. So it is basic difference between the primary and the secondary ossification center. Some exceptions are there. As far as this primary ossification center, now clavicle, all long bones ossify from two primary centers. Clavicle is the only long bone which ossify from two primary centers. I want to correct myself. All long bones ossify from one primary center. All long bones, they ossify from one primary center. Only exception is the clavicle bone, which ossify from two primary centers. The first center appears in 5th week of intrauterine life. Second center appears in 6th week of intrauterine life. And both centrifuges at 45th day of intrauterine life. IUL, this is intrauterine life. So this is a unique feature of the clavicle bone, that clavicle bone, it ossify from two primary centers. The next feature, clavicle bone has no medullary cavity. Look at picture. This is the picture of the long bone. These ends, they are known as the epiphysis. And the shaft, this is known as the diaphysis or the shaft. This shaft or diaphysis, it is a cavity, and this cavity is known as the medullary cavity. And the end of the diaphysis is known as the metaphysis. This is the metaphysis. And this is the joint which is known as the cartilaginous growth plate. This is made up of hyaline cartilage. And what type of joint is this? This is a primary cartilaginous joint. So the point is, this is the picture of a typical long bone. This is a picture of typical long bone, and all long bones, they have epiphysis at its both end, and the middle part is the shaft of the long bone, which is known as the diaphysis. End of the diaphysis is known as the metaphysis. So metaphysis and epiphysis, they are connected by a hyaline cartilage, which is known as the cartilaginous growth plate. And this is the joint, primary cartilaginous joint. It means what joint is present between the diaphysis and epiphysis? Answer is, it is primary cartilaginous joint. And this hyaline cartilage or primary cartilaginous joint is responsible for increase in the height. Our height increases till puberty. After the puberty, this hyaline cartilage, it disappears and the metaphysis fuses with the epiphysis. So there is no further increase in the height. This is the medullary cavity which contains the bone marrow. So our point is, clavicle has no medullary cavity. It is the only long bone which has no medullary cavity. Now the next point is, clavicle bone, it is most commonly fractured bone of body. Most commonly fractured bone of the body is the clavicle bone, and most common site for fracture is the junction medial 2/3 and lateral 1/3 of shaft, clavicle bone. So this is the clavicle bone, and this is the junction, medial 2/3 and the lateral 1/3. This is the most common site for fracture. After fracture clavicle, what will be the clinical presentation? Clinical presentation will be sinking or drooping of the upper limb. Sinking of upper limb or drooping of the upper limb. It is like this. The upper limb sinks down because of its own weight after fracture of the clavicle. So what is the function of clavicle? Function of clavicle is weight transfer. Weight transfer from upper limb to vertebral column. And in this function or the weight transfer, it is helped by ligaments also. And the most important ligament is coracoclavicular ligament. Is most important ligament for weight transfer. Other ligaments also present in the clavicle, but the most important ligament is the coracoclavicular ligament. So these are the features of clavicle. And the one more point, the congenital absence of clavicle is known as cleidocranial dysostosis. Congenital absence of clavicle, which dysostosis, cleidocranial dysostosis. So this is all about the clavicle. Thank you so much.